Introducing Professor Michael Field, Professor of Medicine at the University of Sydney and Chair of the Medical School Accreditation Committee, Australian Medical Council. Professor Field, it's been 2 years since the Productivity Commission delivered its research report on Australia's health workforce. Have we progressed much in relieving the shortage of doctors in Australia, particularly in rural and regional areas?
Nigel, progress has been made, but it's really at the input side of the supply line. In other words, our medical schools have undertaken considerable expansion and many new schools have been opened. But people need to understand there's a pipeline effect here. 2 years since initiating these reforms is not enough time to put those doctors into the workforce. We need 5 years plus. It takes 4 to 6 years to do the basic medical training plus postgraduate work. So I think an initial step has been taken, but we're not going to see the benefit in the workforce for a few more years.
Professor Field, it's widely accepted that overseas doctors are now significant contributors to basic health services in public hospitals and much of rural general practice. Is bringing in more overseas trained people the way to solve the problem?
The question is, can we do without overseas trained doctors? As I said before, we are doing a great deal to increase the numbers of Australian graduates. A few years ago we were putting out about 1,200 a year. It's already up nearer to 2,000, and projections for all the new medical schools suggest it will be up near to 3,000 graduates per year in another 5 to 10 years. Now, what this will do will be to greatly reduce the dependence on overseas trained doctors coming in, but in reality the gap in our workforce is so large that all I think we can do is reduce the dependence on overseas trained doctors, and I suspect that we will always need and indeed welcome a number of overseas trained doctors. It's a matter of reducing that dependence.
There has been recent criticism that overseas doctors are not properly tested for medical knowledge and clinical skills. What's your view?
The issue here really is the process that's been involved. I'm quite confident that the Australian Medical Council's process of written and clinical examinations does filter through and only allow into our workforce as full practitioners doctors with appropriate training and standards. But you may not be aware that there have been pathways to bypass the AMC process, and the area of need concept and all of the alternative methods that state jurisdictions have needed to use over the previous years have allowed some practitioners in without that filter, and this applies both to specialists and non-specialists. The AMC does provide a one-stop entry point for proper assessment of those two categories, and I'm pleased to say that COAG and governments are now looking to revise all of the methods of entry to ensure that they do channel through an agreed process of assessment. So that is undergoing change at this time.
Professor Field, is there merit in the suggestion that we should expand the health workforce by creating new models of care involving nurse practitioners, physician assistants, carers and other, quote, doctor extenders, unquote?
I know this question's controversial, Nigel, but I have a clear view, and that is that it is a reasonable way to go. Look at the geography of our country, look at the maldistribution of healthcare resources, and look at the pressure on our medical practitioners. The reality is that it would be a more efficient use of the doctors we have and will have in the future if we thoroughly train others to a level of expertise that is appropriate for the task they're being asked to give. Running vaccination clinics, doing child checks within certain defined parameters. It's worked well overseas, and in our country, with its vast remote and rural areas, there is no doubt that this is a thing that we should look at seriously, and of course we've started to do so. It's all about appropriate training, and it's all about setting standards that are appropriate for what we ask these other health workers to do. And I think, frankly, that doctors in the end will find their own job satisfaction go up for the reason that they'll be able to do things that call on higher order training and skills, while some of the more routine aspects of their current work can reasonably be done by other health workers.
Professor Field, you'll be participating in the debate at the Addressing the Healthcare Skills Crisis Conference on the 27th to the 28th of March in Sydney. What would you like to see come out of the conference?
Nigel, you know what I'd like to see come out? No one answer, no one magic bullet, but an understanding by all participants and others who read the materials of the complexity of the issue. There are too many suggestions for quick fixes and what should be done. I think COAG has initiated a number of important suggestions. These are being followed through on, and I think that if people come to the conference and listen to the different points of view, they'll realise that it is an enormously complex area. We are making progress, but they should not come with preconceived ideas before they hear the full complexity involved.
Professor Michael Field, thanks for joining us.
Pleasure, Nigel.
For more information about the Addressing the Healthcare Skills Crisis Summit, visit www.informa.com.au/healthcare skills.